Hello, and welcome to another live broadcast with MedStar Health. My name is Michelle Bowman, and I'm joined today by Dr. Timothy Shope, Chief of Bariatric Surgery at MedStar Washington Hospital Center, Dr. Christopher Yu, Bariatric Surgeon and Co-Director of the Robotic Surgery Program at MedStar Franklin Square Medical Center, and one of our patients, Latarsha Reed. Today, we're going to discuss bariatric or surgical weight loss and the services our experts provide at MedStar Health. It's the perfect time because, as we all know, at the start of the new year, we tend to think about how to make positive changes to our health, happiness, and quality of life. So if you'd like to learn more, keep watching. Share this broadcast with your friends on social media. Give us a like to let us know that you're watching, and ask us questions in the comments below. We're going to take some time to answer those a little later. So Dr. Shope, Dr. Yu, and Latarsha, thank you so much for joining us today. We really appreciate you taking the time out to join us. Before we begin our discussion, Dr. Shope, will you tell our viewers a little bit about yourself and the work you do here at MedStar Health?
Sure. Good afternoon, everyone. Dr. Tim Shope here. I am the Chief of Bariatric Surgery for the MedStar Health DC region hospitals. I grew up outside of Philly, did my surgery residency program in Albany, New York, did a fellowship at Hershey Medical Center for Penn State, and I've been practicing bariatric surgery since 2003, here in DC since 2009. I live in the Maryland suburbs, actually not too far from Dr. Yu, with my wife, 3 kids, and a couple dogs.
Great, thanks again for joining us.
Sure.
And Dr. Yu, will you tell our viewers a little bit about yourself and your expertise?
Sure. So I am one of the bariatric surgeons at MedStar Franklin Square, and I also do some general surgery as well. I grew up in Georgia, so a little bit far away from here, and then went to school at Hopkins, then went to medical school in Georgia. I can't tell you the name of the medical school because they keep on changing their name. And then came up here to Baltimore, and I trained at Union Memorial Hospital, which is part of MedStar, and then started my practice in 2008. And then came to Franklin Square in 2010, where we started the bariatric program here, and have been here since. And like Dr. Shope said, I live in the suburbs of Maryland, and I also have 3 kids, but only 1 dog.
Thanks again, Dr. Yu. Let's get started with a few of our questions for our doctors. So, Dr. Shope, could you provide an overview of the bariatric surgery program and the key services available at MedStar Health?
Sure. So we currently have 4 hospitals within the MedStar system that provide bariatric surgery services. Our program here at MedStar Washington Hospital Center, Dr. Yu's program at MedStar Franklin Square, and the program at MedStar Montgomery Medical Center are all accredited nationally through the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. The 4th program is located at MedStar St. Mary's Hospital. They're a little younger than we are, only about 3 years old or so they're going through the accreditation process. All of our programs have immediate access to the important components of bariatric surgery that will help patients like Latarsha achieve success. We all have highly trained and experienced surgeons. We've got full-time dedicated RD staff, as registered dietitians. We've got nursing, support staff, psychological and psychiatric support, everything really here to be able to complete the picture for these patients. We've got exercise physiologists on board if necessary. Some of our centers will also have non-surgical options that are available. The surgeries that we provide for patients include the sleeve gastrectomy, the gastric bypass surgery, adjustable gastric banding, or lap band sometimes called, and the duodenal switch procedure. Some of our sites will also provide access to patients for revisional surgeries, and those, for example, that are seeking greater weight loss or some issue with a surgery that was done 15, 20, 30 years ago.
Great, thank you, Dr. Shope, for explaining that. It sounds like there's plenty of options available as well. So I think there are a lot of people out there who may think about bariatric surgery, but aren't sure if they're eligible. So Dr. Shope, could you tell us a little bit more about who these procedures are designed for and who could be a good candidate?
Certainly. We all stick pretty closely to the guidelines that were set up by the National Institutes of Health. They put out a consensus statement in 1991 for surgery for severe obesity. Certainly things have changed a lot since 1991, and maybe we need to take another look at this. But until we do, these are the guidelines that we generally stick to. There have been new procedures, a better understanding of the disease process itself that have led to some subtle changes. But generally speaking, the guidelines include a patient is a candidate if they have a body mass index or BMI of more than 40, or more than 35 with certain severe associated symptoms, including diabetes mellitus or obstructive sleep apnea, for example. For those of you who aren't familiar with the term body mass index or BMI, it's basically a ratio of our weight to our height. There are online calculators, online charts that are available that you can check for yourself, or certainly talk to your primary care doctor or any one of us, and we can certainly help you identify what that is. The NIH would like to also see a well-informed and motivated patient. And I think, Dr. You and I would agree with that as well. We have to make sure our patients really know what they're signing up for, how to maximize the results, and be firmly motivated and committed to the long-term follow-up that's necessary for success. Patients should not have any psychiatric conditions that are not treated or managed well. And there are some patients for whom the risks of surgery would outweigh the potential benefits, and they may not be ideal candidates. It's important to also mention, I think, that some insurance companies will have some other specific requirements, but that's something that, as an individual basis, the general guidelines are the ones I set out above.
Okay. Thank you so much, Dr. Shope, for
Sure.
just running through all of that. Turning over to Dr. Yu, what have you seen in terms of advancements in bariatric care over the recent years, and how are these changes impacting patients for the better?
So there's a couple things. I think one of the biggest things that bariatric surgery has done is that we have become really data driven. We are part of a consortium of hospitals and programs rather, where we submit our data and our outcomes to this group. So it's called MBSA-QIP, but you don't have to know that. We get data back from them about how we are performing. And so we're constantly reviewing how we're doing and how we can make things better. As part of that group, there's also some standardization about what's required of each program and each hospital that's involved. And I think really having that multidisciplinary approach and having involvement of all the different departments of the hospital really help to make sure that outcomes are as good as they are. And bariatric surgery is one of those few disciplines where we can say that we know our outcomes. It's surprising how many other surgical disciplines or even medical disciplines, they don't really know how they're doing in terms of how they're treating their patients, but we actually do. And I think that's really been a powerful tool for us to really make bariatric surgery so much safer than it used to be. Because, even 20 years ago, we would hear stories about things. And even when patients come in, they talk about how, their friends or family members may have had an experience that wasn't positive. But I think we've really done a lot of work to minimize risk and to improve outcomes and to really improve the patient experience. So I think that's a big factor for us. The other is one of the big advancements is, of course, moving to minimally invasive surgery, where instead of making a big open incision, we're actually just using small ports to perform surgery. And we also have the robotic system available to us. And in some cases, this can actually help reduce pain and allow us to do things that may have not been possible before.
That's awesome. That's great to hear. Especially safety factor is very important for a lot of patients as well. So thank you for explaining that, Dr. Yu. Now, Doctor, you also serve as co-director of the robotic surgery program at MedStar Franklin Square, as I mentioned earlier, and perform 100% of the surgical procedures using the Da Vinci robotic surgical system. So could you address the role that technology has played in optimizing the patient experience and outcomes, and also possibly explain a little bit more of what makes the Da Vinci system different?
Okay, yeah. So I think by nature, surgeons, we tend to innovate because we face a lot of different problems, and we try to do what we can to fix those problems, and it involves bringing in new things, new tools, new ways of thinking. For us, the robotic system, uh, it, it may not help in all situations because I think laparoscopically we can do a lot. But when we're doing procedures that require multiple steps or multiple procedures where we're doing 2 or 3 things at the same time, where we might be repairing a hiatal hernia or doing a gallbladder removal at the same time as a bariatric procedure, or when we're doing a revisional procedure, robotic surgery really helps to make those surgeries safer, less blood loss, less pain, even a shorter hospital stay. So I think in a good amount of cases, robotics helps in those complex cases to make surgery safer. Um, I think that one of the things that we've seen is reduction in narcotic medications that we've had to use. Part of this is in the way that we approach, anesthesia and administration of pain medications around the time of surgery. But we only give 10 to 12 pills of pain meds after surgery when patients come home. And even with that, patients come back to our office with half a bottle or maybe even all the bottle of those pills back. And so we've actually had to get a smart sink where we can dispose of those medications safely in our office. So I think, we've seen the benefit with robotics in terms of how much pain medications we have to give. And I think that's an important aspect in this day and age where, we're really trying to minimize the chance of drug dependence and also misdirection of medications. I think we've seen that that's been a big improvement when using the robotic approach for us.
Good to hear. Thank you, Dr. Yu. So now is a good time to hear from one of our patients, Latarsha. Thank you so much for joining us. You underwent surgery in 2019. Thank you again. Could you explain what the turning point was for you and what convinced you to pursue bariatric surgery and reach out to Dr. Yu?
Thank you for having me. The turning point for me was with high blood pressure and diabetes. I wasn't getting any better. I was getting a lot worse. And I talked to my primary doctor about having the surgery, which he supported me 110% with that. And so my primary doctor had referred me to Dr. Christopher Yu. And I went to see Dr. Yu, and he sat down and talked with me and let me know all the pros and the cons as far as the surgery. And it was the best decision that I could ever had made in life. Um, it just, uh, the turning point also for me was I couldn't really walk really far, and I love to walk. Um, Another thing with my seatbelt, I couldn't put a seatbelt on. Um, it was just so hard for me and difficult for me to even, just do something as small as putting a seatbelt on. So it was many different things that was a turning point for me, but the biggest was my health was declining. Um, my joints hurting. Again, blood pressure and diabetes, which I'm not on diabetes medicine anymore. So that's one of the things that was great about having the surgery.
Thank you very much. That is so great to hear. Uh, what was just going back a little bit? We're going to just dive a little deeper into your journey. What was life like at that time? You mentioned that you couldn't use a regular seatbelt, that you just had to make different adjustments. Um, how could you just further elaborate on that and tell what that experience was like, and possibly for yourself and also for your family? What was it like going
Uh,
through at that time?
Um, mentally, I really felt depressed because I just felt like I couldn't even get a seatbelt on. And for my family, I'm grateful that I had their support, but um, it was just so difficult for me at that time, just knowing who I was. I didn't know who I was. I wasn't confident about myself because I'm like, okay, I'm 500 pounds and counting. And so it was just so mentally draining for me during that time. So I was like, I have to do something. I have to do something for me. I have to make some type of changes in my life for me because during that time, my children were adults, young adults then. And so I was like, it's time for me to start living for me. And so I sat my children down and I talked with them about, you know, wanting to have the surgery. And, I had two of them like, okay, Ma, I support you. But the other two were like, well, Ma, what if something happened to you during the surgery? I was like, well, if I don't have the surgery, I can possibly die prematurely. So I had to make them understand that aspect. So, um, didn't only prepare myself for what I was about to do, but I had to prepare my children. And so they was supportive, but I was really, really depressed about, who I was and the condition I was in. And so I had to have a different mindset as far as what I wanted to do for me.
Thank you. Thank you very, very much for just pouring your heart out and just sharing your journey with us. I can only imagine how difficult it was at that time, and you look great, and you've
Thank
kudos to you for going through this whole experience and continuing on with it. So that's amazing.
you.
So today you are 220 pounds lighter. You look fantastic. You got your energy and all that. Post surgery, after this that surgery process, what has changed? What is life like for you now?
I am so more confident about who I am. Like you mentioned, I have so much energy to where my kids are like, Ma, you need to sit down somewhere. But I just have so much energy and knowing who I am, knowing that I am beautiful inside and out, and just able to share my story, able to come out my shell and to really be around people more now and to talk to people because before I was like really reserved before the surgery. I didn't want to really be around people, but now after the surgery, I'm just so excited about who I'm becoming. And so I'm just super excited about everything that's going on.
Awesome, awesome. Thank you very much, Latasha. We're excited to have you share the perspective of the patient and what it's like to actually go through this process. And all of you watching, we hope that you found her journey inspiring and educational. I do want to take a minute to pause here and welcome anyone who may have just joined. You're watching our Facebook Live with bariatric surgeons, Dr. Timothy Shope and Dr. Christopher Yu, as well as one of our patients, Latarsha Reed. Today, we're discussing bariatric or surgical weight loss and the related services that we provide at MedStar Health. If you find this interesting, share this with your friends on social media, give us a like to let us know that you're watching, and ask questions and comments below. We're going to take some time to share those as well. So I want to turn back over to Dr. Shope. It's important to get it's important for prospective patients to understand the steps involved with preparing for surgery. So could you walk us through that process and what patients can expect?
Sure. Just real quick though, first, Latasha, thank you so much for sharing your story. I can't tell you how rewarding it is for Dr. Yu and myself to hear not just see the number on the scale, but to hear that perspective that you have of how much your life has changed and what it really means to you. So one of the more rewarding things that we do to get that feedback. So the process is fairly comprehensive, and it's going to sound like a lot, but I promise you can get through it, and I promise that our programs will help you get through it step by step. The initial process, or the initial part of the program, starts with an online seminar, which we can provide access to folks for you, so you can sit in the comfort of your home and start to learn a little bit more about the procedures, about the programs, about some of the requirements. After you have that seminar completed, you can schedule a meeting with your surgeon so that we can determine whether or not you're actually a candidate for surgery. Talk to you about some of the surgical options, or maybe some options that aren't appropriate for some patients. And then once that meeting is completed, we will help you get scheduled up for the registered dietitian visits. Those are going to be regularly scheduled meetings. The length of the program and the process, the number of meetings, that's going to vary a little bit based on an individual's insurance coverage. We'll have that conversation with you to the best that we can at that initial meeting, just so that everyone knows it can be up to 6 months or more, again, depending on your insurance. Every patient that comes through a program also has to have a psychological or psychiatric evaluation. Overwhelmingly, those are just a single visit with a psychologist or psychiatrist. Rarely they find something that they think the patient needs to work on for a little bit of time, but most of the time that's a single visit. We usually have the patients schedule visits with their primary care doctor for a formal medical evaluation. Our program, and I think most across the country, do also require a support group. These are run at least monthly, where patients like Latasha can meet with folks that have already had surgery, some of them decades ago, some patients who are about to have surgery, some of them coming through the program just like they might be. And it's an important component because the patients will get to have the perspective of people that are living this. I've not had this surgery, so I can't give them that perspective. But the patients that have had it can actually talk to them about it. Most of the patients, some of the patients will have to have visits with medical specialists. That's dependent usually on their insurance companies. Some will require a cardiology visit, for example. And then patients get started on their preoperative diet, which is anywhere from 10 days to 2 weeks prior to surgery. We have a pre-op class, which we use to summarize everything that they've been going through for the past 6 months or so. It's important to sort of get a refresher, I think, right before you have surgery. And then there's the day of surgery. And I think the most important part of this is that the day of surgery is the beginning, not the end of the process.
Great. Thank you so much for walking us through that.
Sure.
Dr. Yu, understanding the process to prepare for surgery is one thing, but understanding the lifestyle changes necessary is a different thing. So we understand that this is not a quick fix. So could you further explain that, what that means to you?
Sure. So I think one of the misperceptions that we see is that this is just a quick fix, and that this is the way out, or this is the easy way, and it really isn't. As our understanding of weight management has changed over the last decade or so, we understand that it's not just about calories in and calories out. Genetics plays a role, hormones play a role, and medical conditions and medications that people take play a role. And so for many patients, they are trying, they are doing their best, and they're not seeing the results. And so it really is a misperception to think that this is the easy way out. For many patients, we see this as their only way out. And when you go through the process, it's not like you just have surgery and you can forget about it. You have to have ongoing, you have to tend to your body and to your diet and your exercise for the rest of your life. And so it's definitely not the easy way out. In fact, it probably, in a sense, it kind of just levels the playing field in a sense. I don't know if that's a great analogy, but you're still going to have to do those things that you would have done to manage your weight before and after surgery. And I think the biggest thing that I see is that it comes down to organization. I think people want to do well. I think they want to try. I think they want to make the effort. It's just when, life hits, and stressors come, because we're not organized, and we haven't built those habits into our lives, we can easily get off track. And so my encouragement to patients is to, really think about, after they have the surgery, again, like Dr. Shope said, it's the beginning. How are you going to build those habits into your life? How are you going to make sure that, you're just not going to eat whatever comes up during the course of the day when you're busy, that you've planned ahead, that you maybe already have, your lunch that you brought from home, or that you have snacks that are good go-to snacks, and things like that. So I think being organized, thinking about not just what your day-to-day routine is going to be like, but what happens when stressors come. I mean, everybody talks about COVID, and how it's because of COVID that I gained weight, and that's simply not true. Yes, it is emotionally stressful. Yes, it brings a different set of situations to deal with. But when it comes down to it, I think we really need to kind of think about it and be mindful and be strong. I mean, this is a fight. In many things in life, we have to fight for things, and this really is, being strong mentally, being strong emotionally, having support from other people. So there's so many things, and it's definitely not the easy way out. It's not an easy fix for sure.
Great, thank you, Dr. Yu. And Latarsha, could you speak a little bit about your experience of what these lifestyle changes have been for you and how important they've been in your journey?
It's been extremely awesome. Just the tools that I've gotten from being part of the bariatric team has been phenomenal, and I'm able to apply it every day. And to kind of piggyback on what Dr. You was stating, you have to make yourself priority one. You have to mentally say, you know what, I have to do this for Latarsha. It's not for anybody else, it's for Latarsha. And once you mentally get that in your mind and get it in your heart and your spirit, then you can say, well, you know what? I have to take one step in front of the other to be a better you. And so, in me taking the tools that Dr. Yu and the bariatric team has given me, I'm able to apply it every day of my life. And it's been so phenomenal to utilize those tools in my life and then also to share it with other people.
Thank you, Latarsha. You mentioned that education and support piece. So as a patient of the bariatric program at MedStar Health, what support have you taken advantage of throughout your journey?
The support groups on Facebook. That's really important to me being a part of that and able to pick up the phone and call Karen Wheeler if I have an issue with anything. She's always available to me and open and honest with me. And I was able to talk to Jenny and others that's part of the bariatric team that they really have an open policy that if I need someone to talk to, I'm able to pick up the phone and say, look, I need to talk. I need an outlet. So they're always available to my needs.
Awesome. That's great to hear. All of the outreach that you've done and the support that you're getting in return. That's great to hear, especially for people who may just be interested in wanting more information about what what the lifestyle changes are like. So at this time, we have received a few questions on social media. So I want to take some time to answer those. And thank you very much for sharing these. So first question comes from Michelle. Thank you very much. She says, are there any new safety measures in place with us being in a pandemic? Any precautions or anything to take into account during COVID?
Chris, do you want to go ahead and answer that first?
Sure. So one of the first things we did was transition so we have classes each month, and we used to do that in a group setting several times a month. patients would come to one of those each month. And so we rapidly transitioned those to a virtual setting. And so for some of the weight management things, you won't actually have to come in physically to undergo the teaching and the education, the requirements for the procedure. In addition, some other components of the requirements can be done virtually, depending upon the program and depending on the availability. So dietitian visits may or may not be virtual. Psych visits may or may not be virtual, depending. And so we've really tried to do what we can to, minimize physical contact. And of course, in the offices, we're all set up for, minimizing the number of patients who are in the office at any one time, making sure that everyone's masked, socially distanced. And if we can, we try to do virtual visits in the office as well. In the hospital, so things are, in some ways, I often think that the OR is the safest place in the hospital, because, we're used to doing those type of things. And we already have ways to sequester COVID patients who might need surgery from the OR. So, while there's also the risk of that happening, I think we've taken a lot of good measures in terms of minimizing the risk. And hopefully, things are going to actually get better, with the vaccine coming out and being distributed, so that we're not going to have to, I think we're always going to have to be concerned about it and be mindful of it. But, I think that the restrictions that we have in place may be loosened up. I think the hardest challenge actually with the program and with the surgery is going through the procedure and your family can't be there. So I've done what I can to try to make that easier in terms of making sure patients can contact me directly. But overall, I mean, I think from a COVID standpoint, things are very well set apart.
Sorry, I thought you were finished, Chris.
Okay.
I think that, our specialty has allowed us to be, because we can do a lot of this stuff virtually, it has allowed us to keep running throughout all of this. The only thing I think I would add to what Dr. Yu laid out there was that, all of our patients, before they come into the holding area for surgery, are required to take a COVID test so that we know everybody that's there is going to be negative. All of MedStar Health requires that all of us as providers of care are going to take a screening test every day. I have to click on a link and take a screening quiz that I'm doing okay and I don't have any symptoms. I don't have any fever. And so we're doing what we can to reassure every patient that the people that are going to be taking care of you and the people that you're going to be around are going to be safe from and not expose you to something that we don't want to expose you to as well.
Great, thank you both, Dr. Yu and Dr. Shope. And thank you, Michelle, for sharing your question with us. We have a question from Sabrina. Thank you very much for submitting that to us. They ask, what is the process for skin removal after the weight loss?
We refer you to plastics. I'm mostly kidding, but I think the process actually starts much before the idea of actually having surgery for it. So when patients come back to see us in the office post-operatively, I always ask, are you having a problem with excess skin? Are you getting skin irritation or a rash underneath the skin fold? Talking about those symptoms and documenting it in the chart for patients is really setting the stage for a possible surgery down the road. I encourage patients to have that same conversation with their primary care doctors, their dermatologists, anybody else that they're seeing about those problems. They get a prescription. We need to make sure that we document that they've got prescriptions, because the idea here is that the skin surgery itself needs to be thought of as a medical problem, not a cosmetic problem.
All
I don't know if you have anything to add, Chris.
No, I mean, I think exactly what you said. We have to convince the insurance company that it's a medical issue, and so having that paper trail there, and seeing that there's an ongoing issue, really helps to make sure that we can get approval from an insurance side from that.
Great, thank you. Thank you, Sabrina, as well, for submitting that question to us. We have a comment from Stacy. They say Dr. Yu's bedside manner was impeccable. So just kudos to you, Dr. Yu. Have a proud patient there. Thank you, Stacy, for that comment. We have another comment from Darian. Thank you for sharing. They say, proud of you, Latarsha. You are amazing. So some kudos to you, all of you, Dr. Yu, Dr. Shope, Latarsha, thank you again for just sharing your journey with us and providing some more information about what this process is like for patients. We have one last question from Crystal. Thank you for sharing this with us, Crystal. She asks, she says, I was referred to your program by my primary care doctor, but COVID hit and they didn't make an appointment. So what number should they call to get one? Or where should they go to first? Maybe call, is there a phone number, or should we refer them to our website? What's the best route?
So probably the best route is the website and do the online seminar. And then from there, it'll actually give you the choices of all 4 programs. And then you can just, go to the program that's closest to you. So not knowing where this person is from, I think that would be the best way to go about it.
All right. Thank you. Thank you, Crystal, for sharing your question. So for all of our viewers watching, I know some of you may be eager to learn a little bit more and possibly get started with the surgical weight loss process. The very first step, as we mentioned earlier, is to find out more and participate in the MedStar Health Bariatric Surgery Seminar. So it's designed to educate patients and their families and open a door for specific questions to be answered. The questions are offered online, which is great. So even during this time, during COVID, you can learn from the comfort of your own home and get your questions answered. So for more information and to find out about upcoming sessions, visit medstarhealth.org/bariatric weight loss. We're going to provide that link for you as well in the comments below. So thank you. All that is a wrap for our broadcast. Thank you, Dr. Yu, Dr. Shope, and Latarsha for taking the time to join us. We really appreciate it. And thank you to all of our viewers for tuning in and sharing your comments and questions. For more information, as I said before, visit medstarhealth.org/bariatric weight loss for more information. We'll see you next time.
Thanks, Rashawn. Take care, everybody.
Thank you.
Thanks.